Well, I don't have any slides. And really, don't expect from me that I can tell you how you're going to have a successful career. I don't think this is something that you can really plan in the sense, oh, I'm going to be the greatest mother on earth. I think a lot of things happen to you in life. And if I look back to my career of how things happened, I think there are a few things that I try to share a little bit of my story, because I think maybe that's something that you will find useful. And I think if I think from today, research is really about learning. And research is about trying to understand. And research is full of frustration. But I don't think it's really frustration. I think frustration is part of the learning process. But you make a lot of things, discoveries that at the end turn out not to be what you thought about, what they are. And these are sometimes the most important ones, because this is where you correct your learning, your ideas. And so I don't think, because I was yesterday at a PhD thesis, and the lady said, well, you know, research is so much full of frustrations. And I thought, it's not frustration, it's correcting your ideas about where you are going. But it's going to happen. You're going to start with enthusiasm, and you should start with enthusiasm about your ideas. You want to show the world that this is the right thing to do, and this is where you're going, and you're going to be right, and this is going to be great, and you're going to have the greatest paper in the greatest journals, and this is what the career is all about. I don't think it is. So let me tell you how it came along when I was young. When I was young, asthma allergies was clear. There was no questions about what this was. It was about allergen exposure, and it was about air pollution. That was the paradigm of these days, and this is how I learned it. And I thought, okay, there's not much more to discover, right? I mean, this is what it is. And the only thing that we should maybe show at this stage is that it's the amount of impact that it does. So in these days, I started in a children's hospital, Dr. von Hall in a children's hospital, about 30 years ago, and I mostly had a clinical training. It's a different system in Germany than it is here in the UK. And I stumbled into research. It was not my primary thing. I thought I wanted to be a pediatrician, but that was all I knew in life at that stage. I stumbled a little bit into research because that's how I got my job. It was an academic hospital, and they said, if you want to have this job, I'm sure you don't mind to do a little bit of research, right? What do you say? No, I don't mind. And I'm trying to say this is how I got into this, okay? And at that time, there was the Bavarian Ministry for the Environment had a call. Now, it wasn't a call. Basically, they said croup were so important and were so related to air pollution, and one should study this. And the money was given to my boss. And my boss had problems because gastroenterology was not really, the lady had no contract and he needed the money. You know how these things are. And this is how I got into this. I really stumbled into this. And the first study I did on this croup thing, I did all the mistakes you can possibly do because I was left alone. I hope this is not going to happen to you because the system has improved. But yes, making mistakes is pretty good. Because making mistakes tells you this is not the way things should be, right? And at the end, there were these reporters from newspapers who wanted to know our results, and it was so damn, how should I say, disappointing, because we had made so many mistakes we couldn't say really what was going on. So I swore to myself, if I'm ever going to do research again, I'm going to do something, A, that's really interesting, B, that's relevant to the population, and C, that we're going to do well. Because I put so much effort into this group stuff, and you know, at the end, if you don't really learn about this thing, is it really worth the effort? So I think, you know, mistakes is important, and make you learn that things need to be done well if you want to really understand, if you really want to get into research. And research is about discovery, but it's about learning. So then I told my boss that I wanted to get out of this. I thought it was so frustrating. I didn't want to get into this. And my boss said, as many of your mentors will say, probably, look, there's money here, there's some grants, why don't you get this money and do something? It was that way. And I said, okay, I'm going to do something. It's going to be very expensive. It's going to be a good grant. It's going to be challenging, and it's going to be important. It's not going to be group. It's going to be asthma, because at that time I was in asthma outpatient clinics, and I thought this is much more relevant. And at that time in Germany there was no data on prevalences, so nobody knew whether this was a real problem, whether there was an increase. Any things that we now take for granted at that time were completely open questions. So we started this, and then 25 years ago, a few days ago, the wall came down. I don't know, for me, reliving this experience just a few days ago. They had this celebration in Berlin, and it was like being back 25 years, this excitement, this anxiety, whether this would be a bloody revolution, and at the end it was such a wonderful, peaceful thing that happened in Germany. And yet it gave us the opportunity, because we had always felt, okay, it's air pollution, that's clear. But in Munich, the air is pretty good, and so maybe we're not going to be able to find any effects of air pollution, and we really should go to GDR, to the other side of Germany, and at that time it was completely impossible, because of the political system. And then the wall came down, this incredible event, all these stories with the wall coming down 25 years ago. And in any case, we jumped on it. It was an opportunity, and we jumped on it. And we went. It was so difficult to find the people in East Germany, because basically there was no contact, right? But with friends and with, basically I found people in East Germany who eventually came to Munich and took on our protocols, our ideas, and basically they went with those ideas and they did the first studies, and you know what? We got these results, and they were exactly the opposite of what we had thought. Exactly the opposite. So I said, okay, let's re-enter the data. I didn't believe it. The people said, no, we did it twice, and so on and so forth. And then in the very polluted area, there was much less allergies and asthma. So completely different from what we had thought. And then basically, I had some support in Munich, but then I was a little bit left alone. And through friends of mine, they said, well, I think it's better, you're a clinician, that's fine, but you should go and study somewhere where people know how to do things. That's good advice. And I was very lucky. I met Fernando in a train ride in Bochum from the first AUKCAR meeting, and as was the only person in the US I knew, and that's why I came to you. It's incredible, but that's how naive I was at that time. And I was Fernando's first fellow, and I still take a lot of pride of being so. And Fernando was my mentor. And a mentorship is extremely important. In our case, it was, I think it was, in a way, it was a perfect match. Fernando had a lot of time. We spent days and days and days and days discussing. And Fernando said, okay, look, here's your desk. Here's a computer. You have your data with you. You start working. And I said, what should I do? I didn't have the faintest idea of how doing this. But then, with Fernando's help, I learned statistics. I ran these programs myself. I understood what sort of mistakes you can do it, and how important it is to understand your data, and not just from a clinical point of view, but also from an epi point of view. And there's another interesting, and I think that the mentorship is important. The mistakes are important. The frustrations, as I said, is a learning experience. I wouldn't call them frustrations. The other thing that was important is we had this observation of East and West, completely different than what anybody had thought of. And I had a close friendship and collaboration with a lady in Switzerland, Charlotte von Fallender. She's a professor in epidemiology in Basel. And she had set up a study that had inspired me. She looked at rural and urban areas in Switzerland, and she looked at different air pollution levels, and she did this together with Harvard people. And this is how I had thought about doing my studies. And she had a doctor in her team, a doctor from a little village. He's a school doctor. He sees kids at school, and for some reason, he was interested in allergies. And together with Professor Wildrich, every year he made allergy tests in these children. And this guy is a very interesting person because he's a very good observer. And this guy said, you know what, children from farms, they don't have asthma allergies. I don't believe they have. And he tried, this is an air pollution study, okay? Everybody's into particles, into NO2, into SO2, and here comes the guy and says, farmers all have hay fever. And Charlotte is a very, how shall I say, social person who tries to integrate views and ideas, and she said, one more question is questionnaire. I don't care. And it was the decisive question. It was the decisive question because at the end he was right in his observation, and this is how this story took off, that farmers' children have less asthma. Charlotte saw that in her rural-urban differences, it wasn't that much the air pollution, but within the rural areas, it was those farmers who had less asthma allergies. And we took it on in Bavaria and so on and so forth, and this is how this whole thing developed. So the next, I think, important thing is that trust your senses. Trust your senses, trust your intuition. If you see something that doesn't fit paradigms, don't think you're wrong. Think there might be something that's really interesting there and follow those things. Now the paradigm is the hygiene hypothesis, and I'm certainly contributed to this. But maybe it's wrong. Maybe it's all wrong. Maybe it's something completely different that we're not thinking about. So trust your intuition, trust your senses in looking at your data. Remember, the first time we had all these data, there was a statistician that said, look, in these Munich studies, the East-West German studies, we had Munich and the rural areas, said there's only one signal here that's really important. I remember it was a big table, and he said this one is the only important signal. It was an odds ratio of 0.5, and it was about heating with wood or coal at home. Okay? So what did you do? We did nothing. We didn't publish, we didn't understand, we didn't. But then after the wall had come down, then the whole thing about daycare, about the hygiene hypothesis, sibling stuff, we thought maybe it's traditional lifestyle, and maybe this is why they are protected. And at the end, when this guy Gassner in Switzerland came into play, it was clear that the farmers are those that heat with wood and coal. And this was just a proxy for being a farmer. And this is how the whole story came along. And in fact, we didn't publish this finding until when I was back in Germany, because it needs time to evolve those ideas and to work on those. So, is this now a plan for a successful career? I'm not so sure it is. I think the most important, if I have my students and I have people who want to get into this, I think you have to love what you do. You have to really want to know. Because it's not an easy way, it's not an easy job, particularly if you do both, if you do clinics and if you do research. It's not easy, so you really you have to want to know, and you have to think. Don't just do things. Think for yourself. Try to understand, because at the end, this is what it's all about, trying to understand, trying to learn. And this is like a stream of things. You're never going to be at the end. You're not going to solve the questions. There are going to be other questions. But you may be able to learn more about the thing. And hopefully, at the end, improve patients' lives. I think this is what we're here about.